I regularly get a bunch of questions about hormones. I will be responding to these questions over a series of videos. I want to remind everyone that I am not a medical doctor, so I cannot provide that perspective. However, I have observed a number of people go on hormones, and I have knowledge based on this collective experience. Also, I will be talking about testosterone and estrogen in each video if there are any differences between the two. Most of the time there are a lot of similarities though. If you are on estrogen, make sure your doctor is reading your lab result as female and not male. If you are on testosterone, make sure your doctor is reading your blood work as male. If your doctor reads your lab results under the wrong gender, he or she may end up taking you off hormones unnecessarily. For example, if you are on testosterone, your red blood cell count will probably be out of range for what is common for a woman, but it will likely be within normal range for a man. Reading your lab results under the correct gender makes a difference. By the way, becoming a regular blood donor can bring your red blood cell count back to a safer level where you're not as at a high risk of a stroke. As I have said before, hormones tend to make people feel better, but what is often not discussed. Hormones and blockers tend to work better than any antidepressants or anti-anxieties at providing a sense of tranquility. That is, when they are working properly. I notice this feeling kicks in after the first 3 weeks of being on hormones. People feel more peaceful than they ever have, even though they are not seeing changes. While going on hormones can make you feel better, going off hormones, or when they are absorbed completely in your body, the opposite effect can take place. If you are going on injections, you need to know your doctor may put you on hormones on a bi-weekly or twice a month basis. It is possible that you will have a hormone crash around 10 days after your injection. This crash can look like a sudden bout of anxiety or depression. It's well known that having PMS or going through menopause can cause people to become emotional, some of them. These intense emotions arise due to a crash in hormones. So if you are on biweekly injections, you might be going through a hormone crash biweekly unnecessarily. So you can ask your doctor to change your injections from every other week to weekly, whereby you receive the same total amount of hormones over the month. To simplify this mathematically, since some people do not easily understand math, I will use what as a base of 100 as a dollar. So if you are injecting 50 cents worth twice a month for a total of $1, you would switch to 25 cents per week for that same total of $1. By having a constant stream of hormones available in your body, you may find you avoid these painful hormone crashes. This change will also mean you need more needles since you're injecting more often. You should be able to purchase them at stores that sell over-the-counter medications, or you can buy them at medical supply companies or veterinary supply companies. If you are dealing with hormone crashes and find yourself feeling bad, I suggest that the next time you feel it approaching or you know that you're going to be approaching your crash, you vigorously exercise for 30 minutes, 2 to 3 days prior, and continue this all the way until you receive your injection. When I say vigorously, I mean I would want you breaking a sweat and also breathing hard. The endorphins released by this exercise should have somewhat of a counteraction against the chemical change in the drop from your hormones. It's really the best you can do since it is a chemically based crash. If you found this video helpful, then please remember to like, share, subscribe, and if you can afford to do so, make a donation to my student loans, which exceed $100,000. Thank you.